If you have tight hip flexors, tight hamstrings, and low back pain, I'm going to show you one exercise that is going to address all three of these key areas at the exact same time. My name is Dr. Grant Elliott, and we have helped thousands of people around the world fully recover from low back pain, disc herniation, and sciatica. And in this episode, number 140 of the Low Back Pain Podcast, I'm going to show you one exercise that can start to get you some serious relief today.
Real quick, if you have not joined my private Facebook group yet, you need to do so. It is called RehabFix Low Back Program. And immediately upon joining, you will receive our free step-by-step sciatica guide. This is the same process that we have taken thousands of our clients through around the world to identify exactly how to fix their sciatica and ultimately become pain-free through our one-on-one coaching program. In this group, you will be able to see our clients and what they're doing for success and additional resources and more free guides. So if you're serious about fixing your back, you need to join this group, RehabFix Low Back Program. See you soon.
So the one exercise that can address your hip flexors, your glutes, hamstrings, and your lower back pain all at once is one of my favorite exercises called the Bretzel. That is with a B, not a P, not a pretzel. It's a Bretzel. In this exercise, it involves laying on your side, raising the top leg up and over, holding that knee to the ground, the bottom leg back as if you're doing a hip flexor stretch, and then rotating towards the back leg repeatedly. This is causing hip flexion on the top leg, which is going to stretch the glute and the hamstring of the top leg, hip extension of the bottom leg and knee flexion, which is going to stretch the quad, stretch the hip flexor. And then by rotating your shoulders repetitively, looking back, we're going to get some rotation through the lumbar and mid spine as well. This is a tough position to get into. And if you are someone who is not able to get into this exercise immediately, I will go through some regressions and steps for how to get into this ultimately. But this one exercise can be extremely effective at loosening up your hips and your lower back all at once. And immediately after doing this, you're going to feel way better. Now, if we can't get into this day one, what can you do to build up to it? Well, first, just start with an open book exercise. This is just raising that top leg up and over, holding that knee to the ground, and then rotating repetitively. This is just restoring that initial rotation that is needed for the Bretzel, but we can isolate this particular movement. So instead of bringing that bottom leg back as if we're doing the Bretzel movement, we're just doing half of it. So just having that top leg bent and over, knee touching the ground, and reaching back and forth. Then separately, we need to be able to get our hip back for the hip flexor stretch. You can work on this by simply doing a normal couch stretch at home, by just holding your leg back in a hip flexor stretch. And some of my favorites after working into this, doing an active hip flexor stretch where you're in a typical lunge position. Instead of grabbing your foot and pulling it up to your butt, you actually use your hamstring muscle and bend your knee repetitively to put yourself into a hip flexor stretch, but without passively doing it. It is an active, controlled hip flexor stretch. Combining these two things and working on the open book exercise and these simple hip flexor stretches will give you some of the initial movement requirements to ultimately be able to get into this Bretzel position. So now when you get into the Bretzel, you're able to get into it more comfortably and you'll be able to rotate through it better, which will only assist you in improving these areas. I recommend doing this on both sides so that we can equal out each side and improve your mobility from all directions and all angles.
Hey, real quick, if you're watching this video and you're resonating with the things that I'm saying and you're ready to be pain-free, just click the link below and you can schedule a call personally with my team so we can meet with you, go over your current situation and figure out what you're missing and help you develop a game plan so that you can finally become pain-free. This is for serious people only, so click the link if you are ready to go. Back to the show.
Now, this is a great mobility movement for the front of the hips, the back of the hips, and the lower back. However, it wouldn't be complete if we didn't provide some strengthening movements for these areas as well, because often tight regions are weak regions too. So we want to mobilize these areas, stretch these areas, but get them strong as well. For the hip flexors, we can simply get a kettlebell or a band, put the band around the feet or the kettlebell on the particular foot that you wish to train the same side hip flexor of, and you're just going to raise that weight or raise that band on that particular side, and you can even march back and forth as well. This is going to be a simple hip flexor raise that is going to help train and strengthen that hip flexor. For the glute and hamstring region, we can perform a few different movements. We can do a simple glute bridge. This would be a simple movement to target the glutes and the hamstrings. We can perform a reverse plank exercise. You're laying on your back. You rest your feet up on a bench, a chair, or a couch in front of you, and then you simply drive your hips straight up into the air, holding your body straight like you're holding a plank, but it's using your posterior chain instead. This is a great isometric and strengthening movement for your glutes and your hamstrings, and of course your lower back as well. So it's hitting these key components so that we can get stronger and get more mobile as we focus on our lower back rehabilitation. As with any of these movements, do them to tolerance, meaning you don't want to go overboard and risk flaring up, but you also don't want to do too little and not get any actual results. This is a very common mistake and confusion that a lot of our clients end up coming to us for because they find all these different exercises on the internet, but they're not exactly sure which ones they should be doing, which ones they should not be doing, or how much of the ones they should be doing should they be doing. So we help individuals identify the right movements for them, and then how many to do and when to do them, and ultimately when to move on to the next stage. And this can be a very, very crucial aspect to appropriate rehab programming that's going to yield results quickly. So if you're trying different exercises, but you kind of feel like you're spinning your tires, you need a better structured approach so that you can see results fast, because realistically, even if you're dealing with disc herniations, sciatica, or other lower back pain, results should be significant within 2 weeks if you are doing the right things. So if you would like us to go over your current plan with you and let you know what we think you might be missing, simply visit the link in the description box to book a call with our team, and we would love to go over your situation with you, deep dive, and figure out the exact plan that will work for you and get you out of pain quickly.
Once again, be sure to join my Facebook group, RehabFix Low Back Program, so you can get additional exclusive content and our free sciatica guide immediately upon joining. If you are watching this on YouTube, please like, comment, and subscribe. If you are listening on your favorite podcast platform, please leave a 5-star rating and review so we can grow this podcast and help reach more individuals who deserve to get results, who feel like they're spinning their tires and getting frustrated in doing so. As always, move more, move in nature, move in the sun. Thank you so much for listening, and have a great day.